Cutemol Emollient Cream is used to moisturize and treat dry, rough, scaly, and itchy skin. It can also be used to treat minor skin irritations such as diaper rash and skin burns from radiation therapy. This cream contains substances that soften and moisturize the skin, reducing itching and flaking. It contains ingredients that protect the skin from irritation, and it works by forming an oily layer on the top of the skin that traps water in the skin. It also contains humectants that draw water into the outer layer of skin and ingredients that soften the top layer of skin cells, helping the skin keep in more water and leaving the skin feeling smoother and softer. It is recommended to use this cream as directed by your doctor and to apply it to the affected area as needed. Make sure to use Cutemol Emollient Cream as directed. Some products may need to be shaken before use, so be sure to check the label. Apply the cream to the affected areas of the skin as needed or as directed by your doctor. The frequency of application will depend on the product and your skin condition. For dry hands, you may need to apply the cream every time you wash your hands throughout the day. If you're using this cream to treat diaper rash, make sure to clean the diaper area well before applying the cream. If you're using it to treat radiation skin burns, check with radiation personnel to see if it can be applied before therapy. Only apply the cream to the skin and avoid sensitive areas like the eyes, mouth, nose, and vaginal/groin area unless directed otherwise. Be sure to check the label for any specific instructions on where not to apply the cream. It's important to use the cream regularly to get the most benefit from it. Apply it after bathing or showering while the skin is still damp, and for very dry skin, your doctor may recommend soaking the area before use. If your condition doesn't improve or worsens, or if you think you may have a serious medical problem, seek medical help immediately. If you experience any burning, stinging, redness, or irritation while using Cutemol Emollient Cream, be sure to inform your doctor or pharmacist. It's important to note that your doctor has determined that the benefits of using this medication outweigh the potential risks of side effects. While most people do not experience serious side effects, it's essential to contact your doctor if you notice any unusual changes in your skin or signs of a skin infection. In rare cases, a serious allergic reaction may occur, so seek medical help immediately if you develop symptoms such as a rash, swelling, severe dizziness, or trouble breathing. Remember that this is not a complete list of potential side effects, so always consult your doctor or pharmacist if you notice any other unusual effects. Before using Cutemol Emollient Cream, make sure to inform your doctor or pharmacist about any allergies you may have. This product may contain inactive ingredients that could cause allergic reactions or other issues. If you have any cuts, infections, or sores on your skin, it's important to consult with your doctor or pharmacist before using this product. Some ingredients in the cream, such as preservatives and fragrance, may increase your sensitivity to the sun. Be sure to check the label for any warnings and ask your doctor or pharmacist if you need to take any special precautions when going out in the sun. They may recommend limiting your time in the sun, avoiding tanning booths and sun lamps, and using sunscreen and protective clothing. If you experience sunburn or skin blisters/redness, notify your doctor right away. If you have acne-prone skin, be cautious as some products may worsen acne. Look for the term non-comedogenic on the label, which means it will not clog pores. Additionally, some products may cause staining or discoloration on clothing, so it's important to ask your doctor or pharmacist for more information. Before undergoing any surgery, inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant, be sure to inform your doctor before using this product. It is also important to consult with your doctor before using Cutemol Emollient Cream if you are breastfeeding, especially if you are applying the product to the breast area. When using Cutemol Emollient Cream, it is important to be aware of potential drug interactions that could affect how your other medications work or increase the risk of serious side effects. It is always recommended to keep a list of all the products you are using, including both prescription and non-prescription drugs, as well as any herbal products, and share this list with your doctor and pharmacist. It is crucial to not make any changes to your medication dosage without first consulting with your doctor. Always seek their approval before starting, stopping, or making any changes to your medications. If this cream is accidentally ingested, it can be harmful. If someone has taken too much and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical attention by calling 911 or contacting a poison control center. In the U.S., the local poison control center can be reached at 1-800-222-1222, and in Canada, residents can call a provincial poison control center. To help prevent dry skin, it's important to use lukewarm water when bathing, take baths or showers less often, keep baths or showers short, and use a humidifier when the air is dry. There are different types of emollient products available, including oils, creams, lotions, and sprays. Some may contain fragrance or other ingredients that could cause sensitivity in some people. It's recommended to consult with your doctor or pharmacist to find the best emollient product for you. If you forget to use Cutemol Emollient Cream on your regular schedule, make sure to use it as soon as you remember. But do not use more cream or use it more frequently than directed to make up for the missed dose. Make sure to check the storage information on the package and ask your pharmacist if you have any questions. Keep all medications out of reach of children and pets. Avoid storing the foam canister near high heat or open flames, and do not puncture or burn the canister because it is under pressure. Do not dispose of medications in the toilet or drain unless instructed. Properly discard this product and it is expired or no longer needed. Check with your pharmacist or local waste disposal company for more information. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.